Again, with the aging, we all know that the senescent cells will come in more, the cancer cell will set in more, as we age. Because our immune system has been compromised, we're having lesser stem cells after 60. That's explain why COVID, the government say that, 60, inject them first. Inject our parents first, or those past 60. Okay, inject them first. I'm 60, so when I went to inject the vaccine recently, they say it's not for you yet, but actually I'm past 60, I went. But they say, no, you are not 60 yet. You can't, you have to wait for your turn. So it depends on how you look at 60, how you are having with a health condition of 60, because we look at the biological age of a person. In anti-aging, we look at biological age. We are not going to look just at the chronological age. So the good part on my side is I don't have gray hair. At 60 and not having gray hair, that is one good part to show I'm younger in a way, okay? Because if we are in the field of anti-aging, we have to present ourselves as people who specialize in reversing aging to a certain extent and extending quality life to the extended years. Add extended quality life to your extended years and not just years to your life. It's no point to extend life if you don't have the quality life. That is important. To do that, you must have precision in regenerative medicine because you have to apply it to all your organs through the cells and the stem cells. Now, a quick one. There's a lot of drugs. There are thousands of drugs from animal source. It's not only from the plant. It's also from the animal source. This is just to give you a few. I cannot be changed too many. There are so many of them. Okay. Moving to the next. This is copyright pictures from our lab. Our very own lab took all these pictures. We took that of a rabbit and a sheep, and we compare with a human. And you will see that they are very close in structure because they are of the same molecules. These are all fetus. Okay, so they show a lot of similarity in the fetal stage. So I always say in the fetal stage, cells of all animals, of all organs, including man sitting on top of the animal kingdom, they're all alike. There is no rejection. If you want to talk about rejection, there's a lot of people who are injecting heparin pre and post surgery to prevent blood clotting. In every hospital of the world, they are using heparin, okay, to prevent the blood clotting. And where does heparin comes from? It comes from pigs. Insulin comes from pigs and cow, from animal. For diabetic patient, they're injecting, okay? So you have to understand there is an animal element all along in our life, okay? Even in the lab, you do have bovine serum as a base to do the experiment in the lab. You see that? Bovine serum is already the word bovine means it contains animal, okay? And in the process of processing the stem cells, they are feeder cells which are from the mouse. So there is an animal element too, okay? Now, this is one of the chart. We have so many other charts. This is one where the Japanese government has been quietly doing a lot of research on animal to human and also from human to animal. Because they're having a lot, they themselves, the Ministry of Health, they call it the Ministry of Labor and Welfare, they are treating a lot of diabetic type 2 patients and type 1 patients. And they come to realize the main problem is they need the pancreas, the islet cells. And they cannot get the islets from the human. So obviously the result won't be well, right? So the only reason is they have to use from an animal. And Japanese are big consumers of pork. So they have to use pig stem cells because they don't have the experience with sheep or rabbit like what we have in Europe. Okay, in Europe, a lot of people are using pigs and cow. But on my side, our company, we don't do cow because I don't take beef. I'm born in the year of cow. So cow is a way kind of a godly to me, although I'm not Hindu, okay? I'm Roman Catholic, but I don't take beef, okay? I don't take a lot of meat anyway, okay? I don't take pork too. So I'm also very Muslim in a way. I've suffered when I go to China or when I go to Hong Kong because I have to choose the food and I have to look for halal restaurant, okay? So the best animal to date will still be the rabbit. If someone would ask me, rabbit has less fat than fish. Rabbit are very clean animals. We are talking about laboratory rabbits and sheep. We are not talking about the rabbits or sheep outside the farm or in the farm around all over the place. They are not. They are domestic. We are talking about laboratories. They have to be bred in SPF environment. SPF, my environment means specific pathogen free. Another name will be VAF, virus antigen free. The word is virus antigen free, no virus, no bacteria in the organs of all these tissue. And it comes from US FDA approved source. It comes from USA, the animals. It didn't come from Europe. It was transferred from US to Europe. These are the best animals. If you use a rabbit in Europe, it'll be $1 Europe, the farm rabbit. But if you use a SPF rabbit, it'll be $600 US per rabbit. And to transfer the rabbit in a plane, to transfer 20 rabbit in a chartered plane, that means no human, okay, only rabbits, okay? The rabbits are flying super business class. That means it's first class. Because the cost of transferring down means you have to book the whole plane. You have to charter the whole plane. So these are the way we are going on. Okay. Again, we have to be very open. We have to look at the world. We cannot only look at one part of the world. We have to look into all the countries of the world, all the developed countries who went into technology. Okay. Here we are talking about cell xenotransplantation. We are not only talking about xenotransplantation. Please be careful. The word xeno is animal. Transplantation can be organ or cell. So the right word to use is cell xenotransplantation or xenocells transplantation. Cell. We only transplant the cells. There's no rejection of cells. Remember in emergency in ICU hospital, you know, when someone have an accident, he could be given some bags of blood. It could be the blood from another person. Is there any rejection? No, there's no rejection. Okay, so look at Japan as one of the developed countries of the world with many Nobel Prize winners in stem cell research with human. They quietly, since 1995, 1993, went over to research on animal. And the chart is going fast with this. Okay, there are a lot of publication here, 115 to date of animal to human, successful publications, you know, with results. So again, they even did it for human to animal, okay? But Japan is not the only country. There are so many other countries. So the good part about us is, I always think that it's not just the stem cells. No, stem cells to us is only I would say 5% of the business. Although we are supplying worldwide, it's only 5%. We have the peptides, we have the vegetal, we have the supplement, we have so many other things. So the good part is all the products at this moment are recognized in Japan. We are probably the first people to have all our products recognized in Japan and sold to Japanese physicians in a legal way. They are exported legally to Japan in a way. That is a good part. So the funny thing is there's a manga coming in next month, you know, a comic, and they drew a picture about me because I've been doing a lot with the Japanese, and our appreciation, Hiko Kimura and the doctor husband, Iso Kimura, did something for me from their side. So I feel so appreciated in a way. Okay, we have been providing a lot of trainings to Japanese doctors and years to gain their trust. Okay, they use the product and they like the products. Now, again, to continue, even in USA, you have 272 publications. Don't ever say there's no publication. Look at the animal to human. 272 publications is a lot. Okay, and what about the rest of the world? Again, there's so many. Okay, it's not only the US, so many. So moving into US, moving into FDA USA, you know, the controlling power of the world on drugs, okay, on pharma. We are moving right to USA with our subsidiary BioPep, a subsidiary of the European Wellness Biomedical Group in Europe. We set up a lab in USA. We do the MYCO organelles, the MO, and in USA, we are submitting an IND to US FDA for the approval, and these are animal source. So look at the level we are moving in. The European Wellness Group is funding the whole project. It's a multi-million project. We make the profits and we fund back all the profits into research because we sincerely think we have to move further. Okay, we have to move and move because life is a learning experience. Technology is changing so fast every day. Even if you were to miss 1 week of news on technology, you are missing a lot here. I always say that. Because every day I would spend 1 hour on technology. What are the new things which came up? What are the new nutritions? What are the new stem cells? What are the new developments by other people? We learn from every one of us and we share with everyone. So moving again, these are the chart. If we are saying only US or Japan, no. It's going quietly in all the countries of the world too. You know, there's so many of them. They are, okay? They are moving a lot here in a way. Although the laws are different in each country, but some countries are opening up in a way. China is opening up in a way. Okay, I would say that. Okay. So again, you know, the safety measures you have to think all the time is, you know, in medicine, first do no harm. So the first thing you have to do will be the source. The source itself must be a clean source, a safe source. Nothing is safer than if it's FDA certified with SPF and VAF for animals. And you must have laboratories SPF animals. This is important. I use the word laboratory and SPF laboratories animal. Please understand, there's still a lot of difference between laboratories and laboratory SPF animals. That means they are lab animals, both of them are, but these are SPF. Okay, these are important. We are the only one, probably the sponsors are the only one in the world insisting on SPF animals because we want total safety. We do not want to have any problem. That is important. What about the human source? We are dealing a lot with the human stem cells. You must have the best source. Okay, the best source will be you have to know the donor. You must know the donor because you will not, if you don't know the donor, means you do not know where the stem cells are coming from. So it's good to know the donor. You have to ask for some documentation in the way, the donor, okay, or the hospital who donated some information. So these are some of the certification. I do not want to explain, so I've already done so, okay. Certifications are very important. If someone were to give you something without certification, it's not good enough. Now again, this chart, I come to realize this PowerPoint, there's some old presentation put in because it was last minute. I asked my people to do it. They didn't upgrade it very well. Okay. Now, these are all our products and we analyze it this way. Okay. How we do the manufacturing. Manufacturers can cheat easily. Even the doctors will not know. The promoters may not know. Okay. So in manufacturing, it is important to understand that it can be 1 coffee to 8,000. It can also be 2 coffee into 1 coffee or 60 coffee into 1 coffee. You know, so you have to understand that it depends on how you do it. So when we have our precursor stem cells, it's always 60 fetuses into 1 wire or 5 ml. It's a lot. 60 is to 1. You move further down, okay, like the MO or NOP, they go further down, they become very little. Okay, so this is very important, very, very important. Now, this is another example of our stem cells and peptides, because a lot of people is asking, Mike, you have so many other things with you. Can you give me a chart to show something about this? So this is our own chart in our own lab, in our own clinic, our own materials. These are the comparison we can tell you. We make it very clear here to what level they can perform. Our cells, our products, our peptides. These are the level. So these give you a simple guideline to what extent they are working. I always say the stem cells and the cells, but we also have the peptides. These are the amino short change proteins of the cells. Okay, a component of the cells. Okay, they still work, but they will never be as good as the cells or the stem cells. Obviously, you're only taking a part of the cells and the stem cells. You don't expect them to be as good as the cell or the stem cells, but they still work. So if someone were to tell me I have fatty liver, what is the best solution? I will not give the stem cells of the live cells because it costs more. Okay? All I need is the peptides. It should be good enough. Okay? But if you have someone who is going to die running short of time, obviously you need a Lamborghini here. Okay, you need to reach a destination within a short time. You must have a fast, high-powered car. So you use Lamborghini. In the other situation of a fatty liver, the person is not going to die overnight or over the next few months. So you have time. So you can even give a Proton Saga or a Tata car, and it will take 12 hours to reach compared to a Lamborghini or 1 hour, but it will reach. Okay, it will still do the job. We have to think of the financial condition of every patient too. Not everyone can afford everything. Okay. So the exosomes, when we introduce exosome and commercialize the exosome in 2010 in A4M in Las Vegas in USA. We have been with A4M for many years. Okay, 20 odd years. Now, the exosomes you have here are human. And now you'll be asking, where the hell do you get the human of the brain, of the skin, of the heart? These are human source of fetuses which died and donated and frozen in time and use it up when we need them. Okay, they come from Australia. They're human. The materials come from USA. These are human, but of course we also have animal base. We have both human and animal. But the one with animal will have all the ranges, all the 400 over types. With human, we only have a few types. Okay? Because there's still people who say, I want the human. So we have to go with that. You really want the human, these are the human. Okay? So it depends on the condition. So again, someone will ask me, what is the difference between human and animal and plant? Let me tell you. You need the organs, you have to get it from the animal or the human. You cannot get the organs of a plant. There's no fetuses in the plant, right? Okay. But again, with the human and animal, if you are 60 years old, to get it from your own cells, how good is the quality of your cells? Your cells is as aged as your biological age. You are 60 chronologically doesn't mean you're 60 overall. You could be more than 60, or you can be younger by 60, depends on your condition. Okay, so your cells are as old as your biological cells. So I will always think that if I have to take my cells, then I better take my grandchildren's cells. Okay, and my grandchildren's cells will be younger. But the only limitation is what cells are found there? Mesenchymal cells. Only mesenchymal cells is there. The rest of the cells are not there. That is the problem. Okay, the rest of the cells were never found there. So you need the hepatocyte, you need the cardiomyocyte, you need the pineal gland. You can't, because there's no such cells. So you have to look at the situation to give the right cells and not just to sell the cells. Physicians shouldn't be just selling something for the money. We must be selling something with a conscience to sell and where it really works for the patient. Because the patient is going to rely a lot on the physician. They're putting all the trust there. So it's important. Again, another question comes to me. Mike, You say the peptides don't work as well as the cells. Yes, it won't work as good as the cells. And neither will the cell work better than the stem cells. Obviously, okay, the quality is different. You cannot compare a Rolls Royce with a Toyota Corolla, or you go further down with a Tata car. You can't. Okay, there are different ranges with different prices. There's always a price for everything. Of course, there are also people who will sell a Tata car at a higher price. Those are overpricing. So we have to look at the condition. Now, then what about exosomes? I heard from people exosomes are better than stem cells. My answer is no. Because we deal with exosomes all the time. You have exosomes all the time. The only name for exosome is secretones. Okay? The cells would excrete a waste. That waste is called exosome. It is released by the cells. Cells mean living material. Okay? So the cells and the stem cells will excrete, and that excretion is called the exosomes. So sometimes, exactly like the peptides, you may not need the cells of the stem cell, then you use the exosome. But it depends on the condition. So if you were to give the cells and the stem cells, you're already giving the exosomes. It's already there. It's all in one. Everything is inside one, right? So that is the difference. Now, next move to the vegetal. When we introduced vegetal placenta to the world in 1999, it captured a lot of people and a lot of questions. People will ask, placenta vegetal? How can placenta have vegetal? Okay, how can the vegetal, the plant has a placenta? We are talking about the buds and shoot of the plant. In the buds and shoot of the plant, in the early stage, they contains a lot of plant embryonic cells. Okay, we call them germotherapy, a kind of phytotherapy. Okay, they can be made into concentrated form, into tinctures, okay, and they can be made into injectable forms too. Okay, so that is where we go in. So we have the oral one in liposomal form, where it can be put as a few drops into a drink. Normally we use 15 drops, which is 1 ml, 15 to 28 ml drops, okay, equal to 1 ml. Or we can put it into your tongue, okay, sublingual. Sublingual good is good because it's liposomal way of application. So these are oral. This is available. It doesn't cost a lot of money. It's in fact quite cheap and very affordable to everyone, because we have to think of the masses. We cannot say everything is expensive and you cannot afford it. We can't do that. It is a job of every physician to treat everyone, irrespective of whether they have the money or they don't have the money. Okay, you still have to treat the patient. Okay, you don't have the money, maybe you have to wait for the result longer. You have the money, you pay more, probably you get something more better. It's just like you go to a hotel. You go to a hotel, a 5-star hotel will have everything nice. The room is nice, everything is included. You go to a 2-star hotel, maybe the bathroom is outside, you have to share the bathroom. Okay, you go to a 6-star hotel, they pick you up from the airport and pick you up from your house and send you back to your house when you arrive. So these are the quality which is also important. Okay, now the range which is coming next month will be the PHYTO range. This has been done in Europe for the last 30 odd years, approved in Europe in a way. We have the therapeutic range, we have the oral range. The oral range will be called the Swiss Natural. The therapeutic range will be called the MF Plus. I think my IT people make a mistake here. There is another bottle by the IT Plus, okay, by the name of MF Plus. So when we say phyto means obviously it's vegetal, it's plant. When we say MYCO means some mushroom. It involves the study of mushroom. We spend a lot of years, the Japanese and the Orientals, the Chinese spend a lot of time on mushroom study. For 3 over decades, they have been doing a lot of extensive study. So we work together, and I spent a lot of time for 3 over decades on this, although it was not released to Asia. And this is the right time for us to release to Asia, is because we sincerely think that the world needs it now. Because a lot of people sometimes now, because of the COVID, they say, oh, I turned vegan. I cannot take animal. I cannot even take egg, you know. So even the egg also I cannot take. So I only need vegetal. So this is what we call the vegetal range. Okay, MYCO is not PHYTO. So we have to use the word vegetal. Okay. Now, please remember there's a lot of good things with MYCO, but it's the concentration here. We create them into nano size. So they can be having the same result with sublingual and injection. But the injection one has a stronger strength. That is for doctors. Okay. So that is a good part for people who say, oh, I don't want this animal, I don't want human. Okay, then we have the animal. But we only have the peptides. We didn't give the stem cells. Okay. We only have the peptides for this, for the vegetal. This is the world once of its kind, and we will introduce it next month. Okay. End of next month, they will be around in the market. Okay, so these are some of the introduction of the PHYTO we call them the PM range. So you see that you have the oral, you have the therapeutic, okay, and these are the ranges which we have, you know, which are approved with a EU certificate. That means it's widely allowed for sale in Europe, and it can be allowed for sale in most part of the world. I would say most part of the world, even in China, we can do a registration. It's not a problem. Even in Indonesia, we can do a registration. Okay, so you have all the certificate. They are properly manufactured. That is important. Please bear in mind, penicillin was discovered through the mushroom. So there is a lot of good benefit with the mushroom. But the mushroom we have was a super mushroom. It contains all the super mushroom, the best mushroom, and we synergize it in the best formula possible, and it works wonderfully well. Okay, so they have other function. For example, antifungal. That means it's for antifungal problem. It's for fungal problem. Some of us have fungal problem with the skin. You know, so these are some of the things. Again, we have hair loss again. Okay, someone will then ask, Mike, you already have some good solution for the hair one. Why are you coming out with this? Because we also have people who say, oh, sorry, I don't want the animal one. I want non-animal. So these are the solutions. Again, another question, can I use both? Of course you can use both. If you have to use both, you have better results. Okay, I always think more brains is better than one brain. I would never say one brain is better. I always say more brains. More brains means there are a lot of brainstorming. There's a lot of opinions. Okay, so when our medical team assess a patient, if our medical team is assessing a patient, there will be 6 different opinions. Some may be similar and some may be different. The decision has to be arrived with a consensus decision, that it is a collected decision, and that will be the best decision. Okay, if 6 physicians think of the same thing for a patient, that would be the right solution. So with this,